Hi, this is Dr. Wright, and I have a very special guest today. Dr. Karen Herbst is here visiting my clinic, and she's taught the world and myself so much about lipedema, and I'm really glad for her to be here.
It's an honor to be here, Tom. Thank you so much, and thank you. Really appreciate you being willing to help us better understand lipedema.
So what we want to talk about is, does lipedema occur in the trunk? And this is something Dr. Herbst and I feel very strongly about, but you know, is somewhat controversial because our European colleagues say it does not occur in the trunk, and we believe it does.
Agreed, completely. And I think that really lipedema is a systemic disease. It just manifests because of a variety of reasons, primarily because of gravity in the legs, so from the abdomen on down, but also in the upper arms. It's a little, I don't know, we can't explain it as well as gravity, but there is a big piece of fascia on the elbow that holds the tissue. So if fluid were to leak down, it's going to accumulate above the elbow and then build up. So again, gravity might be a big player in why we see it on the limbs, but that it can really occur anywhere. And it's influenced by obesity, any kind of inflammation, any kind of inflammatory disease.
Right, yeah. So, so we bring this up because she has the clear nodules of lipedema, and this in her lower abdomen and even in her pubic area, and this is they're hard, tender, they're completely resistant to weight loss, and they also are swollen, and so we believe these are all signs of lipedema, and we believe this is actually lipedema tissue here in her abdomen.
And she has had an enlarged suprapubic area since she was 16 years of age. So usually when we see fat in the pubic area, we think of lipodystrophy. For example, multiple symmetric lipomatosis or familial partial lipodystrophies have an increased amount of fat in the suprapubic area. Why would she have this at age 16? So this is like a lipodystrophy, and it's obviously therefore abnormal. And so if it can happen in the suprapubic area, why wouldn't it happen in an area adjacent on the abdomen? And I think you can clearly see she has a very small waist here, but she has a bulge of tissue above and below. And again, this is very much so like lipodystrophy for me.
Yeah, I mean, exactly. And so, you know, we do, lipedema is in the lipomatosis, lipodystrophy categories, and really we don't see this outside this suprapubic adiposity and fibrousness outside of lipodystrophies. So it's got to be a lipodystrophy. She has lipedema. I think that's pretty convincing proof that this is lipedema tissue in her trunk.
Agreed.